I'm Kylie Rodriguez. I am the benefits manager here at the consortium, which is your health insurance. And part of what we do here at the consortium is promote our wellness program. It's included and available to all of our members and their dependents. So this is one of the programs. Jason from Excelis is going to talk about MDLive and a program that's available to all of our members. But I am going to do a shameless plug here. So we do have an upcoming eye health webinar on June 24th that's coming up. And we also are focusing on digital detox next month. So if you're interested in trying a digital detox challenge or listening to our speaker, or even learning some tech neck yoga, so neck and shoulder strain caused by being at a keyboard and technology all day. I know I'm looking forward to that one. Feel free to reach out to us at hcwellness@tompkins-co.org to register for any of those, or we can send you additional information. But without further ado, here's Jason to talk about MDLive.
Hi, Kylie. Hi, everybody. Thank you again for joining the Understanding Telemedicine workshop powered by MDLive. Obviously, lots of great collaboration and, working with the entire wellness committee and your wellness program with the Greater Tompkins Consortium. Part of this webinar, we're also providing a registration campaign. So, one of the takeaways here is, hopefully you have registered, or if you haven't yet at any point, is to register for MDLive. So we'll jump right in here. Again, my name is Jason Warshaw, Wellbeing Engagement Consultant here at Excelis Blue Cross Blue Shield. And one of my favorite topics to talk about is indeed MDLive. And, such a great resource, such a great benefit that you have access to. So, obviously with many different tools that are available to Excelis membership, certainly we want to highlight some of the things that we'll see here. And again, our focus is on telemedicine down at the bottom, but, whether it's preventive care, going to your doctor, the consortium offers a biometric screening. So thinking of staying healthy, physical well-being, mental well-being, all the different tools that we have that, really try to look at and identify all those different facets of well-being. And again, telemedicine is such an important tool for all of our members to be aware of, how to access it, have it ready to go. So that's kind of where we are. So again, you are that individual, that member that has Excelis in this specific workshop. So just highlighting some of those things, again, making the most of your health plan. And then in terms of what we'll be talking about today, so just a couple of definitions for display here. Telehealth and telemedicine do actually give you that specific option, right? So maybe your provider is not available, you can't get in. This is a virtual visit. So we'll explain both of those. So telehealth here, whether you're using, your home phone, if you still have one, maybe it's your mobile device, maybe a tablet, but thinking of ways that you can access a provider virtually. And telehealth is with your doctor. Many of the providers within the Excelis network locally may offer specific telehealth resources. Maybe you have had more of those visits over the course of the last several years, whether it is via telephone, video, or email. So maybe you're texting your provider, your primary care. That is a telehealth situation. If you don't know if your provider offers telehealth services, all you have to do is ask. So that might be a convenience factor, having that virtual visit telehealth wise versus telemedicine. So again, we try to equate the two definitions here, with telehealth being with your doctor, telemedicine being with MDLive, which is our partner, our vendor, and has been for well over a decade now. So when your doctor is not available, MDLive will give you that 24/7 access to a United States board certified physician that's practicing with the MDLive team. Again, for non-emergency medical situation services. And again, we do see, many of our colleagues, our peers going to, different modalities of treatment. Hopefully if you have an acute illness, right, you're not going to the emergency room. It's gonna cost you money. So just try to become that better consumer of when you're engaging with healthcare. And MDLive can help you with that. MDLive also does provide behavioral health care. So again, one of the leading, claims that we see for all of our groups, Greater Tompkins being one of them. Specific behavioral health conditions. You can see, stress, anxiety, things that, affect us perhaps on a daily basis, whether we're at work or whether we're at home. So again, just sharing the two definitions here, telehealth, telemedicine, to keep in mind. Telemedicine services, you'll see here again, this is an access piece, right? So it's being able to, on your time, access care when you might need it, whether it is for behavioral health or acute care. And actually, you'll see the third component that's just been recently added here in 2026. But again, you'll be able to connect anytime, anywhere, wherever you are. MDLive providers can diagnose your specific, what you're experiencing, what those symptoms are, what your signs are, what that looks like. They can prescribe medication, again, when applicable, however, not controlled substances. They can help identify a pharmacy. You can actually add the pharmacy of your choice within the app as well. But you can get a prescription to help you where you might need it and wherever you might be. So just a couple of pieces here. So when to use MDLive telemedicine, like I said, so obviously having the relationship with a primary care provider is a key piece that we still want all of our members to have to go to. Again, maybe it's not a need for you, but MDLive can be that supplement. So again, if your doctor is not around, it's after hours, you can see listed here weekends, holidays, 24/7, 365 days a year. Some special bullets, right? So if you can't leave work or if you're, just stuck in your room and you can't get out, you can have that virtual visit there. If you're traveling, so if you're perhaps going on a summer vacation, maybe you've got something planned in the coming weeks, anywhere within the United States, you can use MDLive for that type of visit. If you have kids that are away, children, young adults away at college, again, most schools likely are out and perhaps back home, but maybe gearing up for the fall. If you have children that are graduating, going away to college, this is a great piece that can help supplement when they get care and convenience right on their device when able to join. MDLive is not, so you can see it's not for any sort of life-threatening condition. If you have chest pain, shortness of breath, maybe you've got a broken bone or broken arm, something that happened, trauma to the head, poisoning, any of those things are not applicable uses for MDLive. So just keep that in mind. Again, it's for those everyday acute types of things, whether, maybe you want to talk to somebody, you're in need, you want to, have a conversation, maybe stress is getting to you. But again, potentially life-threatening conditions. Again, those situations, definitely emergency room, are applicable. So again, knowing where to go for care. So here we're going to dive into telemedicine powered by MDLive. So just thinking of those everyday common ailments, common conditions that we have, where you can access a board certified physician, pediatricians, those are available to you 24/7. So, right. So we're in the height of allergy season right now, cold or flu, maybe you have sinus infection, pink eye, right? We're outside more. If you get an insect bite or maybe you're gardening and you come across some poison ivy, those are definitely situations that would be best for you, again, rather quickly, right? So you can, if you have MDLive up and running, within about 10 minutes, you could actually set up that virtual visit. You can actually schedule that appointment for later in the day, maybe after work when it's appropriate, maybe later this evening. Again, just keep that in mind. It's where you are in need, what time is going to work best for you, and that convenience piece of it. In the behavioral health space, so again, thinking of things that impact our daily life, at work, at home, whether it is something where depression is getting to you, maybe it's grief, maybe you've lost a loved one, but you can see here any sort of, behavioral health condition that you might be in need or your family might be in need of getting help with. MDLive does offer that that ability to connect with a psychiatrist, a therapist, family counselor, a social worker in a wide range of conditions that include some of the more common ones that you see on this piece as well, on this page slide. MDLive does not provide behavioral health support for children under 10 years of age or younger. So again, just highlighting acute care behavioral health. In addition to that, so just thinking of some of the pieces, right, that maybe it is a barrier, stigma around getting mental health counseling. Behavioral health telemedicine can help remove those specific barriers, and being able to connect where you are in, a confidential, convenient location for yourself. Maybe it is from your home office or your bedroom. Maybe you can, take your lunch break and have a therapy session. Wait times, right? So nowadays, there might be, a couple weeks before you can actually get a new appointment with a therapist. So again, with in person, if you do have an in-person therapist, continue that. Again, if MDLive is another option that might work better for you, again, wanted to make that plug. Again, MDLive therapists, excuse me, are available when you might need to schedule those ongoing reoccurring appointments. That is something that we certainly want you to take advantage of. Is have that monthly or maybe every couple of weeks, that reoccurring appointment with that therapist. Build that relationship with that therapist so they get to know you, so you get to share, what is impacting your life on a behavioral health side of things. Again, as we talked about telehealth, telemedicine, both types of visits, there are consultations that are, in this case, for behavioral health, must be provided via audio and video within the MDLive HIPAA compliant and secure portal. So just wanted to call that out as well. So brand new, glad to see that we have continued to open up different avenues for members to get care, in this case, virtually. So now, in addition to behavioral health and acute care, teledermatology has been added. So this is a little bit different rather than a face-to-face. You can see kind of the steps there, if you will, but any sort of dermatological condition that you might be experiencing, you can see 3 are listed there. The other 3, fungal infections, excuse me. Maybe there's a suspicious spot. Again, we're outside more during the warmer months. Maybe you come across, again, poison ivy, that type of thing. Maybe you do experience alopecia, eczema, acne, those things. Again, here is another way for you to get a virtual visit with a teledermatologist. So there's over 3,000 medical conditions. What you need to do really is again, main takeaway is to register your MDLive account. Should you have any sort of dermatological condition that you want to be reviewed, here you're actually uploading at least 3 photographs of that skin condition that you have. Maybe it's an eczema patch, or again, maybe a bug bite or poison ivy. So you're uploading those pictures. Within 72 hours, you'll get that diagnosis as well as treatment plan on what to do. Prescriptions, if appropriate, would be then prescribed, and you can have them sent to a pharmacy of your choice, wherever you might be. Again, you'll be able to connect with the teledermatology team up to 30 days with that specific submission, with that visit. There's no extra cost for that. So just wanted to call that out. So the cost for a teledermatology visit, excuse me, they'll be really based upon your plan. Once you register, we'll show you how to register your MDLive account. You'll see upfront what that cost share perhaps could be once you get your MDLive account. So it does not require a referral. Obviously, if there are situations where the condition that you have might need further evaluation, that would be part of your treatment plan in that case. Again, highlighting here, the impact of trying to get into, a dermatologist may take weeks. It could take months, depending on availability of appointments and getting in. So here's an opportunity, if you can't get in, to start that conversation and have that teledermatology visit. So again, 3 avenues: acute care, behavioral health, and now teledermatology are available to MDLive registered members, especially with the Greater Tompkins Consortium. As I mentioned here, the cost, right? So we're all cognizant of where we are, hopefully, where we can save money, but where we are spending our money. Your MDLive account will be visible prior to, I'm sorry, I went too fast, will be available when you log in and visible. You can always call your Excellus customer care if you have your Excellus subscriber ID card, the number on the back. You can always ask any sort of related questions with our customer care team, but specifically with MDLive, you can always connect with somebody here at Excellus. So just wanted to call that. So they'll help you understand your benefits, what your coverage is based upon the plan that you have selected, and again, specifically to MDLive. So some of the commonly asked questions that we get, right? So MDLive, is it appropriate for every medical condition? Obviously here it is not. So MDLive is designed to help handle non-emergency medical and behavioral health conditions. However, it's again not intended to replace the relationship that you have with your primary care provider, physician, general physician, pediatrician, in that instance. And as well as we already discussed here, any sort of life-threatening emergency is not appropriate use of care with MDLive. So when should I use telemedicine with MDLive? Again, you can't get in. It's, maybe you're out of state on vacation. You can't get into your doctor's office for any reason. MDLive certainly could be a better alternative for you in that space. Again, we want you to, after today, we want you to have your MDLive account ready to go. Maybe you never use it, but it's there. It's a backup in that instance of when you should use MDLive. So when is MDLive available? Like I said already, it is 24/7, 365 days a year. The MDLive board certified providers are available throughout all 50 states. So it's like, let's say you're, planning a vacation, you're out of state, maybe you're in Florida or South Carolina, you would see a board certified physician that's licensed to practice medicine in that state. So just keep that in mind. Again, if you have children away, or maybe they are in an out of state campus or university college, having MDLive, they'll see a board certified physician there as well. So there's actually the last question on here. Is there a fee to register with MDLive? No. So you're only charged, based again upon the plan that you have when you actually complete that MDLive physician visit for an acute or for behavioral health or for teledermatology. So again, you'll see that cost up front before starting any visit. Just want to keep that in mind. And, I think, a quick plug for the benefits that you have with Greater Tompkins, right? So at this point, you actually do have a $0 copay for accessing MDLive providers there. So just a great resource. We're trying to help where you are going for care, and MDLive, again, no cost share either from your plan's perspectives. So how to register, right? So obviously to entice, many of the different wellness programs and strategies and, programs that you have with Greater Tompkins, if you register your MDLive account, we're going to be awarding some great prizes like we have done throughout the past several years. Again, this is your kind of opportunity to do that. So registering your MDLive account is something we want you to do. So, as you would with going to any new provider, again, once you complete your registration, there is a health profile on there that you'll need to complete. It's critical if you have specific, medications or allergies to medications that you are not going to need, should you be having that prescription sent to you. But you can add your dependents. So just keep in mind, any dependent that you have, spouse, they will have to create their own MDLive account. So again, anybody over the age of 18 that's on your plan as a dependent or spouse will have to create their own MDLive. You'll need your Excellus Blue Cross Blue Shield member ID card handy as you go through the registration process. So again, have it up and running. And again, you can see the four ways here. One of the easiest ways to register, if you have your smartphone handy, as I'm walking through the rest of the presentation, if you text the word Excel to 635-483, MDLive has what's called Sophie. She's basically a triage. She'll help you register. And once you have your MDLive account up and running, she actually will be the one that will help set up your visits, understand your signs and symptoms. But four ways that are listed here. We often want our members to be registered with their Excel account, so you can actually access MDLive that way and register once you log into your Excel account. You can download the MDLive app and walk through the steps on your own. The texting feature is nice because they'll ask all the appropriate questions. You just have to implement them. If you like to talk to somebody, and I'll make a plug as well at the end today, the 866-692-5045. MDLive will help you register your MDLive account, get your username, password, and insurance information ready to go so that you have access to MDLive at any point. There is a fifth way. You can go to mdlive.com. If you have a desktop, you can go right there. Again, same kind of similar steps. So the text registration option looks like this. I just wanted to put a couple of graphics there of what I said, Sophie. So she'll ask you those questions. Let's get started. What's your first name? What's your last name? What's the subscriber ID on that account? Keep in mind that you will need your full subscriber ID, including the three-letter prefix when you register your MDLive account. But just showing you the text features is relatively easy, so you should be able to get through that if you haven't already created an MDLive account. Showing you just a couple of screenshots. I won't go into too much detail here, but just really highlighting the steps that it takes. So if you have never created your Excel account, again, we want you to have that ready to go. If you have already done it, you can log in your Excel, and then you'll see that there's set up a telemedicine visit. It'll click activate. It'll actually transfer you over. You'll fill out the appropriate answers to those questions. Again, first name, last name. Are you the subscriber? What's your date of birth, phone number, zip code? That's all on there. So again, just calling that out. Lastly, as I will make another reference to it, having your Excel subscriber ID card is handy here. So in this case, search for that benefit provider. You're going to implement Excel BCBS, and then that's where you're going to put in your Excel subscriber ID and the member and medical insurance ID. If you are a dependent, you would click that in that case. So just highlighting, walking you through the should you try the Excelis way. So right through the mobile app, very similar in what's offered here. You'll just follow the step-by-steps. Again, MDLive is a benefit, Excelis BCBS, and then your subscriber ID, including that three-letter prefix. So this is what it looks like if you went directly to the mobile app. So scheduling, any appointment, right? So first of all, if you have your MDLive account ready to go, you're going to be selecting if it is indeed for yourself or if it is for a dependent. Reminder that, if you do have dependents that are under the age of 18, you simply add them to your MDLive account in that case. So who's going to have the visit, the type of visit that you're looking to select, again, whether it is medical, that acute care visit, common types of ailments that we see, or maybe you're looking to set up a general session for therapy or perhaps psychiatry. And then now as you log in, you'll also start to see that specific question. I do want to take a quick pause there. I see that there's a couple of items that have appeared in the chat. If we're good, maybe we can. Okay, so it looks like Kylie has put in some things there to review your plan. So she's just highlighting where to go to get that specific information from the Greater Tompkins Consortium. So great comments. Thank you, Kylie. So we'll carry on here. Any sort of symptoms, rash, stuffy nose, maybe it's an itchy spot. Maybe it is a time for a teledermatology visit. So what you're experiencing in that current situation and time. You can choose the provider. Maybe there's a specific language or a gender that you're looking to see for a specific provider. You can choose the provider. You can schedule the appointment for later this afternoon. Again, maybe on your lunch break, you could schedule a visit, or if you need immediate care, you've got this awful cold, stuffy nose, you just can't shake or cough. You can schedule that appointment again when it's going to fit best within your schedule after the visit. So, obviously you can share that specific telemedicine visit with MDLive with your provider, right? So it's keeping your provider connected. You do have to enter your provider's fax number and contact information so that you can share it with your primary care to let them know that, hey, I couldn't get in over the weekend to see you, so I had a visit with MDLive. Here's the outcome of that. Here is what that visit looked like. And, being able to share that summary with your provider, you can do that as well. So that's scheduling the specific appointment. Again, in summary here, and then I'm actually going to transition. I'm going to show you what it looks like at mdlive.com if everything goes well, and I'll log in there. But again, register your MDLive, have your telemedicine MDLive account activated, have it ready to go should you need it at any point, at any time down the road. Just want to make a quick plug. I know Kylie did make some plugs, but June is Men's Health Awareness. So, for those coworkers that are men, certainly quick 5 steps. We actually will host our webinar at the end of June. So I just wanted to make that quick. So with that, I'm going to see if there are any questions at this time. If not, I'm going to share with you your MDLive. So anybody on the phone, Kylie, did you have any questions, any comments that you want to make? And then I'll show you a quick tutorial demo.
I didn't see any questions in the chat.
All right, thank you. So, in the event, I know that's a lot of information, but such a great resource for you to have. Again, expanding, your access to care when you need it at any point. So once you register your MDLive account, you can, access your MDLive account on your tablet, your smartphone, or as I'm sharing with you on my laptop today, my work laptop. This is what you'll see for you to basically start your visit, right? So again, the Greater Tompkins Consortium, you have such an excellent benefit. You have no cost share in this, but you can see here, I can actually get started with my acute care visit. So I click that again, wait times 10 minutes or less to see a therapist, anywhere from 1 to 2 days, and getting that talk therapy, getting that session up there, you know, whatever might be impacting your life at that time. That is there, as well as psychiatry, right? So, and sort of any sort of medication management when it comes to your mental health. Again, you'll be able to access 2 to 3 days there. So, lower than normal wait times. Again, going in office, there might be, weeks. It could be much more time. The dermatology piece, right? So you should see once you log in, once you've entered your Excellus subscriber ID, you'll see that dermatologist visit. So I have the 4 buckets there. I can get started at any point. So when I click, the acute care, I can see the first available provider, or I can select an appointment later for in the day. So like, let's say I did that. I would, who's here. I would click continue, and basically Sophie is going to help ask those specific questions for you about what those experiences, what those symptoms might be currently. Maybe I have terrible allergies to hay fever. I would select that. So again, this is where you're going to be starting your visit: medication refill, a rash, UTI, those types of things. But I'm not going to advance past this because it then likely could start to set up my visit. So just wanted to walk you through that as well. So I'm going to go back here, bear with me. And again, so taking you back to the main page, a therapist, right? So I can click get started here. Again, I would continue. Oh, I'm sorry. Is there a question? Somebody have a comment? All right. I didn't hear anything. So the therapist, right? So I can really start to share what I'm dealing with what's going on. If it is stress at work or at school, maybe it's just something I am not sure. I need help. I need to talk to somebody. This is how you can start that specific visit. They will provide you with some specific mental health. You can search for other conditions. You can see here, providers cannot fill out paperwork like disability applications, emotional support, animal letters, leave from work notes, or legal documents seeking a provider that primarily prescribes medication. Again, you'll have to schedule that with a psychiatrist. If it is a mental health crisis, certainly this is probably not the best avenue, but rather the suicide and crisis lifeline. If that is a situation, that is 988. It's everywhere, available 24/7, and emergency information. Again, behavioral health providers primarily offer individual counseling, but they can advise if couples counseling would be more appropriate. So just keep that in mind. That's where you would start. I'm not experiencing any of this today, so I'm just going to go back to the main page. And I wanted to show you again, psychiatry is very similar in that space, but again, it's with a psychiatrist. The dermatology piece, right? So this is something that's just been added. So responses are within 48 hours to get started here. I'm going to add my symptoms and photos of that skin condition. Again, if it's acne or if it's anything along those lines. So you submit those photos, at least three. The dermatology team will review that. They'll get you a treatment plan, and then you can have that consult. So you'd be able to talk and speak with those 30 days up to. So I won't go any further than that part, but that's where you would set up that specific teledermatology visit on here. Just highlighting here, I'll stay on the main page at the bottom. You can see, obviously, any sort of question. I've had the experience, great experience, might I add, in being on site with groups similar to Greater Tompkins. But we've actually had members where they need to call maybe their health insurance, maybe their copay is not showing. It's not showing on there. But that 866-692-5045 number is awesome. And they can help answer any questions, technical questions, helping you create your MDLive account. Maybe again, your insurance information's not showing. You can always call them, help with password lockouts, those things. But great customer service. I've had nothing but good experience, and hopefully you do have the same. If you do call them, you can email, but that's a live person. That's somebody you can talk to regarding MDLive. I did highlight some of the FAQs on my slide presentation from today, but you can contact MDLive, right? So that's there. Does MDLive have providers in my area? So certainly MDLive has many different, I think it's well over 4,000 board certified physicians that participate and that are licensed to practice in many states. So again, if you're having a visit here and maybe you're in central New York or like I am, or maybe in the Finger Lakes, certainly you'll be able to see a board certified physician that is licensed to practice in New York or wherever you currently are. So you can make referrals. We welcome provider referrals if you're from patients. So if you don't, maybe you have a provider that you want to join, you can do that. But lots of FAQs that are on here. So just keep that in mind. But that help and support number is always there for you. So I'm just going to go back to the main page here because I want to show you the left-hand side of your account. Again, it's going to look different if you're on the mobile app, but once you create your MDLive account, same username, same password through all the different devices, whether you're on a tablet. Like I said, I'm on my laptop today, but my account, right? So if you click here, this is basic information of your overall account. Messages. So if you have messages with a provider, you would see those there. I'm not going to click on a majority of these, but just to highlight what's there. If you've set up maybe reoccurring appointments, or maybe you have a acute care visit for after work today, you would see that there. As you start to use MDLive, you can build a care team to help coordinate your care. So, your first appointment with MDLive. So again, if you're going to continue to have that therapy session monthly, you would see that care team being added there. Again, we want you to do that if therapy is something you're looking to do. Your health profile here is where, just like you would go to a new provider at any point, I and we definitely want you to complete that health profile for the team at MDLive to know again what allergies you have, family history, any sort of previous surgical procedures or current conditions, any other, again, more specifically, medications that you take. So you could also enter those as well. Any labs or imaging, those things that you've uploaded, documents, that those are on there. You can add the pharmacy of your choice. I've got one here in Central New York that we've added and have had a couple of visits over the past year or so. And convenient, right? They can send it to that pharmacy of your choice, or they can help identify one. Maybe you're out of state. That's where you'd see the coverage part, right? So that's where your benefits are. But then help and support, you can change language, but this is really just kind of highlighting what it looks like to you, what you're seeing on the MDLive site. So with that, I know it's a lot of information. I want to open it up to see if there's any remaining questions from anybody that's attended today.
I was just going to make a benefit comment. So on the consortium's platinum plan, MDLive and the behavioral health services are a zero copay. The telederm service does have a specialist copay of $25. So just a heads up on that copay. But some of these tabs that Jason's showing you are great if you have maybe you had to have an appointment for your kid who's sick, but the school wants to see a doctor's note. That's all in these tabs, where you can get the full office visit note. Or for your employer, you can pull it that way, right from your app. So you're not hunting down paperwork or waiting for them to fax it into your employer or the school. So it's a very convenient. And just to give you an idea of cost savings, so an MDLive appointment is a zero copay on the Platinum plan. If you were to go to the emergency room on the Platinum plan, it's a $250 copay. If you go to urgent care, it's a $40 copay. And urgent cares are only open so late at night. So if you're looking to get a prescription after 6 or 7, MDLive might be a great solution for you.
Appreciate that. Thank you, Kylie. Anybody else on today? Do you have any questions? I definitely appreciate the time. If anything, if you do have questions outside after today, feel free to reach out, connect with us, but certainly appreciate the time.
So, you want me to put it in a chat or can you guys hear me?
Yeah, we can hear you. Go ahead. Yep.
All right. So I got on my site, which I probably started 10 years ago when you started this thing, but I've never used it because it's on my computer. Do you have to have it on your phone or can you have it on your computer?
You can have both. So if you wanted to have a visit, if again, if your computer, I'm not sure of your equipment, but it looks like you do have a webcam. So that's part of having that visit. So yeah, I mean, you could have that visit right on your laptop if that's where you want. But again, it's transferable, right? So it's the same. So if you wanted the MDLive app on your phone, you just simply log in with the same username and password. If you have forgotten it, you can have it reset, or you can reach out to MDLive to get it fixed.
So you just download from an app store or something. I missed that one because I'm by myself and I had to get up and help somebody. All right, Kylie will help me. Because I tried to use it once and way back in the day and got frustrated, and so I've promptly ignored it, but now I will try again.
Yeah, you can use the same login if you're anything like me. So I downloaded the app. I was like, I should be able to set this up, no problem. After about 10 minutes, I was like, yep, I was sick at the time. I didn't have focus to do it. I called their customer service. They set up my account over the phone, including setting up my appointment in 10 minutes, and then I could log right into the app. So worst case scenario, calling MDLive customer service is not a bad experience. You're not put on hold forever. You talk to a real human being who will get it all set up for you.
All right. So I'll just add that. Thank you.
Excellent.
I'm always trying to save the consortium.
Thank you.
It's our money, right?
Yes.
Excellent. Again, register your MDLive account. That's all I have for today. I don't know, Kylie, Jess, if you want to close us out.
Yeah, if there's no more questions today, I appreciate everyone's time today learning about MDLive. We will be sending out the recording and the slide deck after. So if you have any follow-up questions, feel free to reach out to Jess or I at the consortium.
Thank you, everybody.
Thank you.
Have a good day.
You too. Bye-bye.